Hi, welcome to the second in our series in your Vet Bill Explained. In this series we're really trying to demystify what's on your vet bill, because we may not have had a chance to have a chat to you about why your racehorse is on a certain medication. We will discuss this with your trainer and be aware of it, but if you're new to racehorse ownership, you may not understand why certain horses are getting certain drugs. So the first in our series we covered ulcer medications. The second is aimed at people that own fillies and mares. Now, fillies and mares will cycle normally, so by that I mean every 21 days they will have an estrus cycle. A lot of mares actually can become quite difficult for a period of 4 or 5 days when they're coming up to ovulation. So they're really what we call in the industry in season. So they're in season to be ready to be covered if they're going to be bred. So we often try and stop that. It's no different to the human version of the pill. It's progesterone we give. So it can be given in a couple of formats. The most common format we use is an oral medication product called Ovumate, and you might see on your bill. Now this is a liquid progesterone. It's got to be given daily to your horse. We usually dispense this to the stable, and the stable staff will administer it. There are some issues with it in the fact that it can be absorbed through the skin, and it is a very strong hormonal drug, so women have got to be very careful handling it. So you give this daily and it stops the mares coming into season. It stops them cycling, makes the body think they're pregnant, no different to the human pill. The next option we have is a product called ReadyServe, which is an injectable form of the Ovumate. You give that once a week. It lasts about 6-7 days. So we give about 3 mils into the muscle once a week, and that is basically a super strong progesterone that we inject into the horse's muscle, and that stops them cycling. So you have to give that once a week. It's a little bit more expensive than the daily Ovumate, but it has less issues with workplace health and safety, and the fact that it's an injection, it's straight in the muscle, we know the horse is getting it. We don't have to syringe it into your horse's mouth every day, and we don't have to have staff handling progesterone. So the benefits of your mare not cycling is a couple of fold. One, behaviour. It can often help a lot of moody mares settle down. Some mares, when they're in season, are very difficult in the barriers, so they'll actually lean against things. So you're trying to have a mare that's racing and she's right on in season, she probably will not perform to her best. The third reason is some mares, when they've got their normal reproductive cycle happening, they can actually get what we call tying up. Now, tying up in simple terms is a severe muscle cramp. Those horses can barely move, and we find when we've got them on progesterone, we decrease the chance of that happening, and they even out. And they just do a lot better. So a lot of mares will go on Ovumate or injectable ReadyServe, and we'll use those all through the horse's career. They don't have any negative on future fertility, so as soon as you take your mare off it, within 4 or 5 days, the mare will be cycling and be ready to be covered. So it's a safe drug for your horse to be on, but that's why it'll be on your bill. If you've got a mare or filly that's a little bit difficult, we'll often put them on Regumate. So again, any questions, give us a ring. We're happy to discuss what's on your vet bill and explain what's happened to your horse. We always do the best by your horse at every instance, but if we can be of any further help or you would like to discuss things further, please give us a ring. Thanks very much. Bye.